All right, this is lesson 8.3. Pathology of pregnancy. Abruptio placentae. That is the premature separation of the placenta, which should normally be implanted. Choriocarcinoma. That's malignant tumor of the placenta. Ectopic pregnancy. This is when the egg implants in a knot in the uterus, so it's misplaced. Placenta previa and preeclampsia. Pathology of the neonate. There's Down syndrome, hemolytic disease of the newborn, hyaline membrane disease, hydrocephalus, meconium aspiration syndrome, and pyloric stenosis. Newborns are scored using the APGAR chart. This is an assessment of the newborn that is usually done between 1 to 5 minutes after they are born. So the sign that is looked at is the heart rate. If it's absent, they get a 0. Below 100, they get a 1. Over 100, they get a 2. Respiratory effort, absent is 0. 1 is slow and irregular. 2 is good, means they're usually crying. Muscle tone, if it's limp, it's 0. There's some flexion, it's 1. And if there's active motion, it's 2. And then they test the nostril after the oropharynx is clear completely of amniotic fluid. So the response to the catheter in the nostril, if there's no response, the score is 0. If they grimace, the score is 1. And if they cough or sneeze, the score is 2. That's normal. Color, if they're blue and pale, it's a 0. If the body is pink but the extremities are blue, there's a 1. And if they're completely pink, then it's a 2. So obviously you want your infant to have all 2s on the APGAR scoring chart. Clinical tests and procedures during the pregnancy would be a pregnancy test and then a pap test or pap smear. Procedures are a hysterosalpingography, mammography, breast ultrasound or breast MRI, pelvic ultrasonography. Conization is a gynecological procedure, which is a removal of a cone-shaped section of the cervix. This figure shows a leap for a cone biopsy. There's also a laparoscopic oophorectomy. This is when the ovary is placed in a plastic bag and then extracted through the laparoscope. Procedures during pregnancy. An amniocentesis is when there's a needle placement guided by ultrasound images into the amniotic fluid. Okay, so let's make sure we know our abbreviations. AB is abortion, AFP is the alpha fetoprotein high levels. BRCA1, BRCA2, these are the breast cancer 1 and 2 genetic mutations that are associated with an increased risk for breast cancer. BSE is the breast self-examination. CA125 is a protein marker that's elevated in ovarian cancer. C-section or CS is cesarean section. CIN, cervical intraepithelial neoplasia. CIS, carcinoma in situ. Chorionic villus sampling, that's CVS. CX stands for cervix. Make sure it's a capital C and a lowercase x. D and C is dilation and curettage. DCIS, ductal carcinoma in situ. DUB, dysfunctional uterine bleeding. FHR, the fetal heart rate. FSH, follicle stimulating hormone. G stands for gravida, which means pregnant. GnRH is gonadotropin releasing hormone. GYN stands for gynecology. HCG is the human chorionic gonadotropin. HDN, hemolytic disease of the newborn. HPV, human papillomavirus. HRT is the hormone replacement therapy. HSZ, hysterosalpingography. IUD is an intrauterine device, which is a contraceptive. IVF is in vitro fertilization. LEEP is the loop electrocautery excision procedure. LH, luteinizing hormone. LMP is the last menstrual period. Multi-P is multipara or multiparous, which means more than one pregnancy. OB stands for obstetrics. Para 2-0-1-2, this would be a particular woman's reproductive history. All right, so 2 means 2 full term, 0 preterm, 1 abortion, and 2 living. Papa-Nicolau smear test, that's the Pap test or Pap smear. PID, pelvic inflammatory disease. PMS, premenstrual syndrome. Primi-P stands for primipara or primiparous. SLN biopsy, or an SNB, is the sentinel lymph node biopsy. TAH-BSO is the total abdominal hysterectomy with bilateral salpingo-oophorectomy. So that's pretty much taken everything out. UAE is the uterine artery embolization. VH is a vaginal hysterectomy. Okay, let's look at our combining forms. A lot of these are repeats from our last lecture as well. Amnio, Bartholino, cephalo, cervico, chorio, choriano, colpo, coldo, apesio, galacto, gyneco, hystero, lacto, mammo, masto, meno, metro, myo, myomo, natty, obstetro, oligo, ufero, ovo, ovario, ovulo, perino, foro, pio, salpingo, utero, vagino, vulvo. Our suffixes are archi, cili, sciasis, ectasis, ectomy, flexion, genesis, gravida, itis, perunia, paris, plasia, plasty, ptosis, ragia, raphy, rhea, salpinx, scopy, stenosis, stomy, tosia, tomy, tresia, version. Prefixes: bi, dis, endo, in, intra, multi, nulli, oxy, peri, pre, primi, pseudo, retro, uni. And that's it. That's the end of lesson 8.3.